I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Today we're going to talk about the Christian and alternative medicine. And Dr. Prather, we consider our practice structure function medicine. The FDA is titled that. But the public, people are used to more of the alternative medicine.
Sure, concept.
Yes. Let's start with the difference between that, alternative medicine and structure function.
Yeah, defining what those differences are sometimes kind of fine in people's minds, and everybody has different interpretations of what's involved with that. What we like to think is that structure function is evidence-based scientific type of a program where we're taking the body and trying to bring it back into homeostasis or balance. Alternative medicine, when people start to talk about that, then the main thing that most of the people who come in, and I'm talking about people's concepts, because everybody has different definitions, for different types of what's involved with that. But usually they say, is this Eastern medicine? Meaning that it's kind of a voodoo. Is it, based on religious philosophies that they may not agree with? Those types of things. And one of the things I try to reassure people is that structure function is basically evidence-based, that it is involved with a very specific program of bringing people back to health. And we look at all the different possibilities on how to balance out the body's homeostasis and how that can be accomplished. So we're very broad on that, but not really a religious undertaking, between underneath that. Whereas most people, when they think of alternative medicine, they think of with a more of a religious belief underneath of a sort of a new age philosophy where you're trying to become enlightened, that type of thing. So and having people understand the difference on that is important.
And that's what we're going to talk about today. So why a radio show on this topic?
Well, I get this question quite a bit. Is this, I'm a Christian coming in, and I don't want to get involved in something that isn't biblically based. And I can understand that. There are people out there who have different types of agendas. In what they're involved with. We have someone who runs massage therapy, who's a Christian, who really looks at massage as one of the ways you can really help to heal people, which is absolutely true. And she was telling me that there are quite a few people who had a religious agenda involved and use massage therapy to kind of promote it. Other people can get involved in different types of healthcare to promote a certain type of a religious agenda on trying to spread their philosophies, which is not really what people want to go to a doctor for. They want to go to a physician, someone who's healing them, and who's basically just looking at trying to fix my problem, make me healthier. And that's really what should be involved, not some underlying type of a agenda that they have to help to change people's minds. So that is a legitimate question. There are people out there who don't have that philosophy in mind. But when you're talking to someone who really identifies them as a structure function doctor, that kind of separates them really from what would be called alternative healthcare. And structure function care is something that's recognized by the FDA, has a lot of evidence-based type of science behind it, and has a very specific course of trying to get people back into homeostasis, balance, which is health.
And that is, the structure function care is how we're defined at the Prather Practice.
It is. I've talked to people in the FDA, and they said, we don't really consider you alternative healthcare. The best definition on you is structure function care, which is something that they actually approve of.
Mm-hmm. And I like that because it encompasses everything we do, both the structure and the function.
Yes, and as you combine the two, you get much better results.
So what are some of the concerns of patients that have come to your office when we talk about, the Christian and alternative medicine?
Sure. I had one woman came in, and she said I don't want to do acupuncture. Whatever you do, don't do acupuncture. I said, are you afraid of needles? And she said, no, that's not it. It's just that my pastor told me that acupuncture was associated with Buddhism, and therefore I shouldn't be involved with it. And I said, well, where did he get that idea? And she said, well, it comes from China, and that's a Buddhist country. And I said, well, acupuncture was in China much longer, was there before Buddhism ever came to China. Mm-hmm. It's a very ancient art, and someone who practices acupuncture in China say, it's associated with Buddhism, they'd laugh at you. Mm-hmm. There's no religious association within acupuncture for any type of a philosophy or religion. That's not its underlying position. Mm-hmm. Now, they might have been familiar with someone who was an acupuncturist promoting Buddhism. Mm-hmm. But the two don't necessarily go together at all. Acupuncture has a tremendous amount of research studies. Mm-hmm. There's a tremendous amount of evidence-based results on that. There's a lot of physiology that goes along with that. And so we're using it to help to balance out the body using the electromagnetic energy of the body, which is something that isn't utilized as a healing property as much as it should. And we get tremendous amount of results that are associated with it. Matter of fact, veterinary acupuncturists. I've had a lot of vets come in and said, I want acupuncture. I've seen it on horses, dogs, and cats. And when it was explained to me in vet school that it was all, placebo, my horses and my cats and my dogs don't really care. Yeah. It's not.
That doesn't work on them.
Yeah, it doesn't work on them. So, the evidence is there on how well it works. It's not associated with any type of religion or philosophy. It's basically can be studied as a science, and that's the best way to actually approach it. Mm-hmm. Now, there are different schools of acupuncture. The school that I belong to is more of the scientific, where we do studies, things like that. There is a peasant Chinese where it was all myth, magic, and acupuncture and that type of philosophy. Mm-hmm. But that's not the type of acupuncture that we use, and that's a very specific type of acupuncture that I've been trained on that is based on science.
So is it mainly acupuncture, or are there other patient concerns?
Yeah, homeopathy. We've had people who sit there and say that they don't want homeopathy because of religious convictions. And I say, well, what do you base that off of? Mm-hmm. And they said, well, it's sort of like a magic type of a formula that works. And I said, well, we don't really know how it works. But the truth of it is that there is a lot of research that is being done on homeopathy. Mm-hmm. I even had a medical doctor say homeopathy is bunk. It's just all placebo. And I asked him, have you ever prescribed nitroglycerin? And he said, of course I have. And I said, well, then if you don't believe in it, why are you prescribing a homeopathic? He said, that's not homeopathic. That's a pharmaceutical. I said, no, it's homeopathy. You're not putting nitroglycerin under somebody's tongue. You'll blow their tongue off. Mm-hmm. Nitroglycerin in a very small amount The reason that they use that is that homeopathy works immediately, and for people who are having chest pains, you don't want to wait an hour or two for the chemicals to work. Homeopathy works very fast, and so you get great results on it. And there are several different pharmaceuticals that are prescribed right now that are homeopathic based. So there is quite a bit of evidence involved with homeopathy. It's something that's used and was used quite a bit. And if you're in France and you get a prescription, 40% of all prescriptions in France are homeopathic based. Mm-hmm. So it's something that's used worldwide, has a lot of efficacy to it. There's always been opposition to homeopathy, that it's been tried to be suppressed by the pharmaceutical industry, but it is something that it has no religious connotations. It's completely safe. There has never been an injury associated with homeopathy, so it's a great thing to try, and always more of a first line type of a treatment than it is as a last resort type of thing.
Okay, when we come back, more on the Christian and alternative medicine. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What is the difference between disease care and structure function care with reading blood work? And if we have a listener that's a new listener with our show, the Prather Practice, we practice structure function care.
Yeah, the FDA divides all care into two different categories. One, disease care model, which is based on pharmaceuticals and symptomatology, and then the structure function care, in which you're dealing with homeostasis. You're achieving homeostasis in the body. And homeostasis is health. Homeostasis is balance, and that homeostasis, if the body's able to achieve balance in homeostasis, then that is the definition of health. So really, we're health doctors. We improve the health of the individuals. We don't treat disease. And when you're interpreting blood work, those are two different ways of looking at it, which is a new paradigm for those who are in the disease care. They don't oftentimes understand. It takes a while to change their whole paradigm on the interpretation. Basically, what they're looking for in the blood work is when you qualify for getting a pharmaceutical. What we're trying to do is to look for what we need to do to achieve a perfect health. And so two different types of models, two different types of ways of looking at it, and getting that model into people's brains is a new paradigm. And it's a new paradigm within the healthcare system. So that's where we approach our model from. I mean, that's one of the reasons I have the radio program. So we're trying to educate and get the word out there, because this is a new paradigm that is hard for people to understand.
Very important. And you talk about how we need both the structure function care and the disease care model.
Correct. A perfect balance on that is 80% of the healthcare should be structure function based, 20% should be disease care model. Because we do refer out for pharmaceuticals, we refer out for surgeries. There are times where the body requires those. We're not against those things at all. It's just that we need a balance, and we need the two groups to work together. One of the things is that there's been a very much of a antagonism between the two groups, and which there surely shouldn't be. When we find the best results in the healthcare system is when the two groups are actually working together for the good and the benefit of the patient.
Amen to that. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. Have you ever been curious about how acupuncture can benefit your health? The Prather Practice has received the Indy A-List Award for Best in Acupuncture for 2 years in a row, and we've been rated the top acupuncture provider by Google+. Dr. Robert Prather is a board-certified licensed acupuncturist. He's earned a reputation for combining effective acupuncture-based techniques with cutting-edge technology to help patients with many conditions. Acupuncture is documented and proven to help with many health issues, including pain, allergies, addiction control, anxiety, fatigue, vision problems, infertility, and so much more. We even have needle-free options for those who are a bit squeamish around needles. Call the Prather Practice to schedule your appointment and experience the benefits of acupuncture for yourself. 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about the Christian and alternative medicine. And before we went to break, we were talking about some of the concerns of patients that have come into the Prather Practice regarding this. And you said acupuncture were sometimes an issue, homeopathy. Also, and homeopathy is based on quantum physics, correct?
Quantum physics, yes. Basically, it's a vibrational medicine. Mm-hmm. And I'm not quite sure why people sometimes think that vibration is anti-Christian, or the concept of it. Where the basis of quantum physics. I mean, your cell phone wouldn't work without the knowledge of quantum physics. 80% of all inventions coming out today are based on quantum physics. So quantum physics has opened up a whole new area, and the homeopathy was actually found out about 200 years ago by Hahnemann, and basically he had an understanding of quantum physics. A very intelligent man, was able to write about quite a bit and how that all worked, and it was he saved Napoleon's army. And as you're looking at different types of treatments out there, homeopathy has been able to show itself as more effective in many of the different types of infectious disease areas where they've kind of compared people in Africa with a cholera outbreak with homeopathic treatments versus pharmaceutical, and usually homeopathy beats pharmaceutical. So there's a tremendous amount of potential there on really solving quite a few of the problems that we have going on, and some of the answers that we need to be open to be able to get the best results.
Are our universities teaching quantum physics?
Well, there is some, but there is some suppression of some of the knowledge of quantum physics. One of the things that quantum physics, astrophysics, needs to take in the God molecule and the mathematical formulas that actually prove God. If you don't include those in, then things don't work right. So one of the things is that our universities, which are controlled by people who don't really believe in God, actually suppress that knowledge. The really only place that you can learn it is in Israel, and that's why Israel is producing about 80% of the new inventions out there, is because of their embracing of the full scope of quantum physics. And so what we're talking about in here, and why we're kind of bringing this up, is that we need to open up our minds and open up our truth and reality, and not suppress it by religious suppressions. And basically the people who are suppressing the knowledge that is important for the advancement of our science is the atheist at this point, who don't really want to look at truth.
Yes, and it's suppressing it all around. We're going to talk more about that too. So, what are some other concerns of patients that come into your office?
Well, herbals. I've had people say, "Well, I don't want to do herbals," and I'm like, "I'm sorry. What? Do you put pepper on your eggs?" And it's like, they're just foods. You're talking about herbs of the field and other different types of aspects that you eat on a daily basis that helps your body to work and balance better.
Jesus probably ate herbs.
Yeah, right. Herbal remedies is also the basis of most pharmaceuticals. So, it's they say, well, herbals can be used, and I said, well, anything can be used in a bad way. It doesn't really make sense, what they're meaning by that. So, there's a lot of misconceptions and misunderstandings, and there have been books that were put out. One of the things is that there were medical doctors who put out books for the Christian to be aware of alternative medicine, and they had a whole list of things, not to get involved with. And they listed those things, acupuncture, homeopathy, and herbals. And it's like, what? They also talked about chiropractic, as something, as if the medical system that we have right now is based on Christian principles, which it's not, and that it is the only way that you can actually heal, which is ridiculous, and that somehow they have the corner on it, and that's a Christian-based healing system, which it's not. They don't really understand the history, their own history, to be able to talk about that. And certainly, not only did they not have a knowledge of the acupuncture, homeopathy, herbals, and other different types of what they considered alternative healthcare, but they don't even have an understanding of their own healthcare system, or the history behind it, or what they're actually promoting. So ignorance is never a good way of coming at any type of a approach, and certainly they weren't qualified to write any type of books or even talk to anybody about anything with the lack of knowledge that they had.
Well, let's talk about that. What is the history of disease-based care, and is it Christian-based?
Well, the system that we're talking about that dominates healthcare system is based on pharmaceuticals, and if you go back into the Greek, it's pharmakos, and it's a philosophy that you use poisons to heal, and if it's not a poison, in other words, if it can't harm you, then it can't get into the pharmaceutical listing. Now, that's a very ancient philosophy. That is not something that, they were saying, well, it's based on science. Well, they use science, but just logically, why would you only use poisons to heal? Instead of nutrients or things that help to balance out the body and bring health in. So that philosophy goes back thousands and thousands of years. The system back in the ancient times was called the Asclepian system of healing. There was a whole science behind it. There was a healthcare centers, universities that they had at different places, and that was actually brought into the United States back in the 1900s, and then it was started to become dominant in 1910. 1930s, they eliminated most of the other different types of systems of healing. worked it down to 1950s, and then there's been a resurgence of some of the other types of healing systems back into to the United States. But there's a very specific history. It's a very ancient history. It's not a modern system of healing. It was a religious group who had developed part of their system as a healing system to help to promote their religion. And really, when you're talking about the philosophy behind modern medicine, it's not based on science, it's based on an ancient religion.
Is that, when you talk about Asclepian, is that the religion or
that is
cult?
The religion. Asclepianism was based off of someone named Asclepius. And Asclepius was the name of the Greek name for Imhotep. Imhotep was an Egyptian who actually really lived. He's the guy who built the pyramids. So he was a very smart man, and built up a whole system that helped to rule Egypt. Part of his system that he felt was important was medicine. So he was a very well versed in medicine, and was known as a physician, and one of the brilliant men of his day. He learned all about the body by taking prisoners and then taking off their skin, and then dissecting them alive as he would taking them down, and then actually figuring out how that would all work.
Okay, I'm squirming.
He also learned about how to keep people alive, and then pain medicine and all those types of things. So and the Egyptian physicians were well known throughout. The philosophy that he brought then to Greece, which there was a lot of trade there, developed and was influenced a lot of Greek society. Some of the famous people who were Asclepians was Plato, Socrates, and then Aristotle was taught by Plato, but he then rejected the Asclepian system and actually talked against it. So, you're talking about quite a bit of influence there. It is a philosophy that had continued, and if you read Plato's Republic, they have a section on doctors, and one of the things that he talks about was that he disparaged doctors who tried to keep people alive, by coddling them, by trying to make them better. He said, just give them a poison, see if it shocks the body into recovering, and if it doesn't, then it's better off that they die, which was an Asclepian thought process. Wow. That's why they used poisons only as the only means of healing, because it didn't allow the people who shouldn't be living to keep on living.
And that's in Plato's Republic.
That's in Plato's Republic.
Easy reading,
right? If you can kind of wade through it. Yes, so Plato's Republic is one of the books of the Asclepian philosophy.
Well, we need to go to break. Hold that thought when we come back. We're talking today about the Christian and alternative medicine. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
They ask the most insulting question when you check into a hospital. What seems to be the problem? What seems? Well, it seems. It seems like everything on my inside wants to be on my outside. But I'm no doctor. What kind of condescending question?
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
Christian and alternative medicine. And this all came up because you hear that a lot, people coming into our practice and, well, my pastor told me not to do acupuncture, and we talked about that,
Sure.
So we were starting to talk about the history of the disease-based care and the Asclepianism. Mm-hmm. Did I say that right?
Close enough.
And I know people are going to ask how to spell that.
There's actually several different ways to spell it. Yeah. So you can either start it. Sometimes they spell it with an A S and then sometimes an A E. But it's a A S
AESCLEPIAN.
Right,
So,
Asclepian.
So what is there a relationship between this Asclepian cult and modern humanism?
Yes. Basically, when you're talking about, they changed the name. Basically, they're not known. Well, sometimes they are. Mm-hmm. There is actually an Asclepian society within the medical profession that you have to be invited into, and you're actually initiated into it. So
Still today.
Mm. But the basis of what the Asclepians call themselves now is humanists. So humanism, which is a major religion and has a great deal of influence throughout America and across the world, has its roots in Asclepianism.
Wow.
And basically it is the exact same philosophy that has been translated into the modern world. Mm-hmm. So when you hear someone that's a espoused humanist say I'm a humanist, basically they're also claiming to be an Asclepian.
But they probably don't even know it. Right?
There are actually a lot of them. Well, once you move up within the humanist, then you start getting into more of the Asclepian philosophies. And they base quite a bit of their beliefs. Plato is, of course, one of their major heroes of the humanist movement, and base quite a bit of their thought process on that. So, it has a tremendous influence nowadays, and had a great deal of influence on shaping the healthcare system of America. Was basically started by humanists, aka also known as Asclepians. Mm-hmm. And so one of their major pushes was to get the humanist philosophy, Asclepian philosophy of medicine into America, and to guide it along those lines.
And you were talking about the history that it happened pretty quickly.
It happened pretty quickly. In 1910, if you go back to 1910, when the Abraham Flexner report came out, only 15% of all the medical doctors practiced the philosophy of the Asclepians. There was only one university, medical university, that taught the Asclepian system exclusively, and that was Johns Hopkins.
Only one.
Only one. All the rest of the medical universities had different types of philosophies. There was about 25 major systems of healing within the, if you were an MD, and there were about 35 alternative type of, non-allopathic systems of healing that were out there. And so when the, and Abraham Fluxner, if you look him up, was a very, very, very passionate humanist, Asclepian, which he would identify himself as, and did quite often. Very opposed to Christianity. He wrote that humanism would trample across the grave of Christianity, and one of his major goals was that Christianity would be eliminated from not only the minds of people, but also from history. So he was actually very passionate anti-Christian. And he was the one who wrote something called the Fluxner Report, basically condemning all other different types of healthcare systems as being inadequate. The only one that should be allowed was the Asclepian model, and that all other healthcare systems should be eliminated. And so he wrote up a paper that was funded by the Rockefeller and Carnegie Foundation, who had invested a huge amount of monies into the pharmaceutical industry.
Oh, do they have any money?
to actually move in that direction. And then they paid every single congressman and senator $100,000 back then to read the report. And so they then, looking at the report, passed different types of laws restricting the practice of all other healthcare systems. And then also they cut off all funding and then squeezed all the different medical schools to only accept a Asclepian system of healthcare, which Harvard was the last one to hold out. And they, after the president of Harvard Medical School died, then they were able to finally take over that one. So it was a process of first taking over all the medical boards, and then also all the other different types of colleges, and so that the only people who could then practice or be taught medically could only get their teaching from the Asclepian viewpoint. And basically, the Asclepian viewpoint is that you use only pharmacos.
Let's talk about
to heal.
What's the meaning behind pharmacos? It sounds like another Greek word.
Yes, it's interpreted as one thing as witchcraft, but the other thing, it was basically the philosophy that you use poisons to heal.
Okay.
Now, I'm not actually opposed to that. As I'm talking about that, using a poison to heal sometimes is actually the best route. But we always talk about the balance between structure-function care and pharmacos, pharmaceutical, using poisons to heal. And we say that should be an 80-20% split.
80%
structure-function care, actually utilizing a lot of the different types of medical philosophies that were used before. And then the disease care, which would be 20% using the pharmacos, the poisons. And the philosophy on that is that you also then look for the underlying causes so that you can correct it, so that you can get off the drugs as quickly as possible. Pharmacos is what we use as the pharmaceuticals that we use nowadays. But they are, but the more that you take, the longer you take them, the more likely you are to suffer some type of consequence, because they are poisons. If they aren't a poison, can't do harm, then they can't be classified as a pharmaceutical. That's a very basic law of pharmaceuticals. The philosophy that you can only use pharmaceuticals for healing is not scientific. In matter of fact, if you actually think about it, is ludicrous. Just from common sense, that would not be the only way that you would approach healthcare. If you do that, you're not going to have. You're going to spend a lot of money with very little results, which creates a healthcare crisis if it continues long enough.
And that's what's happening.
That is exactly what's happening.
In the United States, yeah.
In the United States, we sit there and we talk about where we need to fix the healthcare crisis. And so how can we make the system that we have right now work better? Well, the problem is the system that we have right now is only based on pharmaceuticals. And pharmaceuticals are excellent to get crisis care under control, manage end-life types of situations. And it's excellent in short-term types of bouts where then you try to get... So the system is wrong, not that we're not doing it right. We have the wrong system. Not that we want to eliminate it because it's very valuable. Right. But we need to mesh it and look at things in a much more logical type of a way, instead of letting a ancient religion dictate how we do our healthcare system.
Interesting. It's so important to know the history.
History tells you so much, and then it brings everything into perspective. The American Medical Association was started by the Asclepians, and they actually started it up to suppress homeopathy, because homeopathy was becoming the dominant medical system in the United States, and they were trying to fight against that and to promote the Asclepian method of healing.
Interesting. When we come back, more on the Christian and alternative medicine.
Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, tell us why your weight loss program is unique.
Well, we're not just interested in your weight loss. We're interested in your overall health and well-being. So, again, we are an office that is looking at homeostasis within the body. And homeostasis on your fat percentage is an extremely important part, because that determines a lot of your pH, your hormones. It has a huge effect on how your body actually works. So we're not just looking at, yes, we want you to lose weight, but we want you to lose weight in a healthy manner.
That you'll be able to keep it off.
That you'll be able to keep it off. We don't allow people to gain their weight back. We really try to keep up with them and make sure that they have a lifestyle that maintains their weight, their desired weight. And then we also check to see what is the proper weight that you should be for the percentage of fat, because that is what is really important on this. And we also look at the whole person. What is it that's actually keeping you from being able to get where you want to be, whether it's emotional issues, whether it could be like we had a patient who was low iron. And that low iron was, they just couldn't lose weight until they got their iron levels back up.
Right. We see a lot of, thyroid, endocrine system.
Endocrine system that's out of balance. So we figure out what it is that's going to get you to a healthy state. And as you get to that healthy state, it makes it very easy then to lose the weight. And people are surprised at, that they're able to lose the weight and feel so much better. That's one of the beauties of all this.
And the other thing, too, it's very individualized.
Very individualized.
We have type 1 diabetics on the program. We've had people with type 2 get off their insulin.
Sure.
So with it being medically supervised and blood work is taken, so we know exactly what's going on.
Yes, we do. And that just makes all the difference in the world. And people have different types of, it's amazing how many different individual types of needs and quirks and all sorts of things that people have, and working with them to help them to get where they want to be is always a pleasure.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
It's a beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients.
We're talking today about the Christian and alternative medicine. And Dr. Prather, before we went to break, you were talking about Abraham Flexner and his role in designing modern medicine. And then out of that developed the AMA, the American Medical Association.
Right. The AMA was started before Abraham Flexner.
Okay.
They were put together as a Asclepian organization of medical doctors who adhered to that to help to promote their healthcare system and to eliminate opposition. So their first thing their first target was homeopathy. Matter of fact, it even states in their bylaws that they were formed because they felt homeopathy was going to become the dominant system of healthcare in America. They became very powerful once they started to get the backing of the Rockefellers, Carnegie organization, and some of the other people who were involved in that. So they had unlimited funds, which helped them to really promote their healthcare system and take over and eliminate all the others. As I said, that there were about 25 different medical philosophies in healthcare. One of the ones that I really adhered to is the physiologist. And basically their philosophy was you find out what the physiology of the person and then try to balance it. That there was a perfect normal along those lines and that you could actually discover that. The physiologists were the ones who basically came up with all of our blood tests and lab tests. And then the Asclepians then kind of stole it and took it and then also said that worked well for them too. Just like they got from homeopathy. Homeopathy basically had it was the ones who came up with the double-blind studies. It was homeopaths who came up with that system, which is the gold standard for medical research nowadays. Also, the cleanliness and the high level of manufacture of pills basically was developed by the homeopathic companies and then adopted by the pharmaceutical companies. Matter of fact, one of the homeopathic pharmaceuticals that was working here in the United States was Eli Lilly and Company, which then adopted the pharmaceutical. But they were first herbal and homeopathic before they got into the pharmaceutical area. So it's interesting once you start to get into the history of everything and how much was actually brought about. The first time that I heard about physiologists was when I was reading Dr. Guyton's Physiology for the older doctors like myself. That was the Bible of physiology, medical physiology, and they were talking to him about healthcare. They were talking about pharmaceuticals, and he says, well, I'm not really an Asclepian. And most of the reporters had no idea what he was talking about when he said that. So he said, I don't really follow the Asclepian system of healthcare. He said, I'm more of a physiologist where you really try to balance out the system. And he said, that's more of my medical philosophy. So, there was a group that basically based on herbalism. There were some that looked more at the detoxifying the system. So there was a lot of different types of systems of healthcare out there. when the American Medical Association was giving the legal ability to regulate healthcare, they first eliminated all the medical schools that weren't Asclepian, and then consolidated all those, eliminated all the practitioners, and then they started to go after the alternative, the non-allopathic healthcare systems. So they went through, first off, what they did was nursing was a separate system, and they absorbed that into their system. So they actually brought the nurses, because the nurses were the ones who actually kept people alive, and did most of the work. Then they went through and either eliminated them. The osteopaths capitulated and gave them their schools to be able to teach, as long as they could allow to spend the rest of their life practicing, so they didn't lose their license. So that's why osteopathy stayed around. The last school that the last group that capitulated to the medical philosophy was the podiatrist. They used to be called chiropodists, where they would adjust the feet. And in 1959, they handed over their schools and adopted a system where it was surgery and more of an Asclepian-based type of system. The only group that held out completely, even up till today, is chiropractors. That was the only group that the American Medical Association was not able to eliminate or to assimilate. So chiropractors have been the sort of the banner wavers, and trying to carry on the structure function philosophy of healthcare, and we're the only survivors, and that's why, of course, I went with that. But when you're talking about the Asclepian system, it's interesting. The center of Asclepian's worship and university, the main university that they were working at during the time of Christ, was Pergamon. Was their center of where they actually worked at. And Pergamon, if you want to find out about John's thoughts about Pergamon and the whole Asclepian system, you can read Revelations and look up when he talks to the church of Pergamon. So just a little assignment for those who read the Bible.
Well, I want to make sure to answer this question before we close today, but why should structure function care be allowed to become a part of America's healthcare system?
Because we have the answer to the healthcare crisis. And really, if you're looking at evidence-based, they keep saying evidence-based type of care. Well, the evidence is if you have any eyes at all, the evidence is that pharmaceuticals as a system of healthcare, as by itself, is totally inefficient, expensive, and gives the worst results you possibly could.
And you're saying when it's by itself.
When it's by itself. If you have a 80-20 split where you're trying to do structure function care, bring the body back into homeostasis, along with that, that's really the best method. We don't want to throw out the pharmacos. What we want to do is put it in its proper place in an evidence-based system, not based on religion, but based on science, fact, and common sense.
That makes total sense.
It does.
So 80% structure function medicine and 20%
the pharmautically based, because there are many times where we look at someone, do the analysis, and pharmaceuticals is absolutely what they need.
Right. Well, thank you, Dr. Prather. A lot of information.
Thank you, Lisa.
Very important information. So we appreciate it. The Christian and Alternative Medicine.
The Prather Practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.